Botox. You've heard a lot about it, probably wondered about it. Maybe you've actually had it. Welcome to Talking with Docs. I'm Dr. Brad Winnie.
I'm Dr. Paul Zalzal.
We have a guest today,
Dr. Lauren Willoughby.
Dr.
I thought we
Willoughby.
were talking about botulism.
We kind of are.
Yeah.
Oh, okay.
Yeah.
That's what I looked up.
Yeah, raw honey. Don't rub it on your eyes. It's not taking your wrinkles
Give
away.
it to your under 1-year-old child.
Yeah, for sure. Okay, so we're going to talk all about Botox. We're going to talk a little bit about its history, its uses, its risks, its complications. And then we're going to have a little video of one of our other colleagues who actually gets Botox, and you can see the effects in almost real time.
Is that you?
No. What do you think? Does it look like I got Botox? Maybe I need Botox. Okay, so let's start at the beginning, Lauren. What is Botox? How did we get here?
So Botox is a drug that has a few medical uses. It has some cosmetic uses and it also has some medical uses. But it's a drug that is injected into muscle to help decrease the activity of that muscle. So most people know Botox for the cosmetic uses. So there are a few places that you can inject into in the face that help decrease lines in the face, which we call rhytids. So Botox is an effective cosmetic treatment for wrinkles that are not deep. So there's two different types of wrinkles we call, there's static ones and dynamic ones. So static means ones that you have at rest. Botox generally doesn't work well for those, but it works well for wrinkles that have not formed at rest yet. So when you animate the muscle, you have the crease, and then when you relax, it goes away. So there are a few common places in the face that you would use that. The most common being the crow's feet around here, where the creases that you get when you squint, the ones in your forehead when you frown, and then the ones on the one between your eyebrows when you frown, and then the ones on your forehead when you raise your eyebrows.
And for the anatomy keeners, for the crow's feet, it's orbicularis oculi, right? It's the muscle.
I thought that was a spell on Harry Potter. Are you sure?
No.
Double check that.
And then the frown line ones are even a little bit more odd, which they're corrugator supercilia
Yeah.
and procerus, right?
Yes.
Are you
Yeah.
proud of me?
So
I
proud.
think it's super silly.
It's super silly. Yeah, so those are the muscles that get essentially temporarily paralyzed. That's
Yeah.
the goal.
Yeah, that's right.
Okay.
The thing about Botox is it's a proprietary name, Botox.
It
it's
is.
like
It is.
Kleenex to facial tissue.
Yes, it is.
And
Yeah.
talk about market recognition.
So that leads nicely into, I did a deep dive into the medical history.
Okay.
So in the 70s, there was this ophthalmologist in San Francisco named Dr. Alan Scott, who was doing a lot of studies on strabismus and blepharospasm, so people that had ocular disorders, and he said, well, maybe we should inject this stuff to paralyze the muscles. So first he did it on monkeys, back in the day when we did a lot of animal research, and noticed that this worked, started using it on his clients, and then when they did follow-up, they're like, oh, this is kind of weird. These people have a lot less wrinkles than other people. And did
Those
you
are
know?
some pretty beautiful monkeys he
Right.
created.
So did you know, though, that the ophthalmologist who thought of a cosmetic application for this is from Vancouver?
Come on.
Oh,
Dr.
good.
Jean Carruthers and her husband, Alistair Carruthers, who was a dermatologist, said, guys, I think we got a thing here.
Yeah.
And then Allergan bought it.
Yeah.
And
Off
then
Scott. Allergan bought it off Scott in 91
yeah,
for
so
$9 million.
yeah, so it was approved in '89, for the ophthalmology application. Then in 2002, it became approved for
Yeah,
Allergan.
FDA approved. So it took a while to
Yeah.
get FDA approval for it,
long
but it was only $9 million.
Right.
That was a good ROI for Allergan.
And this year, they estimate the gross sales of Botox for Allergan was going to be approximately $8 billion.
And the patent ran out in, I think, 2019
Yeah.
for Allergan. But because they have such great brand recognition, everyone calls it Botox still.
And also, too, people tend to use a product that they're trained
Sure.
to use when
Right.
And
they're learning.
Yeah.
I searched whether Jean Carruthers got like any money, and she's like got a little bit of research money and the professional recognition. And I thought, well, that seems like a bit of a rip. But we talk on our channel a lot how things are invented for one reason, and then we find out other uses for them. It's very, very common in medicine.
Yeah.
Okay, so what does it look like when someone comes to you and says, hey, I'd like to consider getting Botox?
Yeah, so I always ask them if they've had Botox before, because if they have, then I get a sense of, did they like the effects? Do they want more? Do they want less? How many units did they have? What areas did they focus on? And then I'll examine their face and sort of see what stands out to me, and I would make a recommendation. So I have them animate their face, so I'll have them frown, raise their eyebrows, and squint, and then make an assessment about where it will have the biggest impact.
It's kind of what people do when they watch our videos, all three of those in sequence.
And then, so do you take videos or pictures for them and say, hey, here's what we're kind of targeting, or it's more just kind of
I do sometimes, yeah, or I just give them a mirror.
Right.
Yeah.
Is there an age limit? Like, what if I'm like 102 years old and I'm like, okay, now I want to do Botox? Is that like, has the ship sailed on that?
No, but I mean, most patients who are 100 would have some of those static rhytids
Right.
that it wouldn't help.
Okay. But like, do you have an age limit, or is it more like what the face looks like?
no, what the face looks like and what
Okay.
the patient's goals are.
I would ask more on the other side. I feel like our society is into this right now. And are there younger people that come to you before they get wrinkles? Like, listen, I just don't want to get wrinkles. I don't want to get any of those deep lines. Can we get in
Yep.
front of this?
Yeah. And I'd say that it's kind of a double-edged sword. So you can always find a practitioner who will inject you.
Sure.
But in my opinion, someone younger than their 30s, you're just wasting your money.
Right. Okay.
Because
Good to know.
you
It's
may
not
as well.
prophylactic.
It is in a way, but why? Like most 20-year-olds don't have
Wrinkles.
very deep wrinkles, so you're just wasting your money. Like I in general wouldn't recommend bothering.
I
till
love
you're in
that
your
practical
30s.
approach.
Yeah, buy some cover up for now, till you're 30. Okay. All right, well, do you think we can check it out in action?
Please, yes, let's.
All right. We actually have some live footage, well, recorded footage of Botox injections being performed.
Okay, and on a quick side note, if you want to see more of this kind of stuff and what Dr. Willoughby does, she has both a YouTube channel and a website that we're going to provide a link to if you want to check out some of her other content as well.
It's far more interesting than what we talk about.
Here we go.
Dr. Lauren Willoughby and Dr. Nicole Callan, both of which have been on Talking with Docs many times, and now they're injecting each other, or at least in one direction, right?
Correct. Yeah.
Okay.
Yeah, we're going to do some Botox injections. So we can show a little bit about how we plan Botox, where it goes, and then we're going to do a follow-up in a couple of weeks so you can see the results of them. Okay, so all right, so we're going to show sort of how we analyze where the product is going to go, and then we will do the injection. So one of the most common areas to inject are the creases at the top of the forehead. So raise your eyebrows for us, Nicole. So in general, you want to inject in the upper 2/3 of the forehead. If you go too low, it increases the risk of the brow getting droopy. So raise again. So while she raises her eyebrows, we're going to pick, we usually do about 15 units for Nicole. A white eyeliner pencil is nice because it doesn't,
It washes off.
yeah, it doesn't
So
stick like
nobody
the,
knows you've
like
had
the-
it done.
Gotcha. Are you nervous right now? Are you scared?
No, not really.
I am a little.
Are you?
But
Oh,
I'm
no.
You're gonna
I'll feel
love
better
it.
after
I'm more
this.
worried about when I have to do ugly face.
Okay.
We'll do that last. Yep, so these creases here, so they're from 3 different muscles. There's the procerus in the middle, and there's the corrugator supercilii and the depressor supercilii. So they kind of are all in a group here. So we usually do about 30 units in an average woman. Being an average woman, an above average woman, we'll still do 30, so frown for me. So we're gonna focus a little bit here, and we're going to do, I like to do generally in most women about 5 spots. You want to stay about a finger breadth above the orbital bone, because again, if you get too close to that brow, you can get brow ptosis, so brow droopiness. Not
And
a
what
good look.
were the 3 muscles again?
Procerus is in the middle.
Uh-huh.
There's corrugator supercilii. That's the one over here that will give you those
Okay.
kind of vertical lines. And there's depressor supercilii, which is kind of in between them.
I think my supercilii is a little hypertrophied.
It may be too late for you, though.
Supercilii, really?
Which one was my
Beyond.
angry one? Which muscle
The
is the
procerus
angry
is in
one?
the
Where I
middle.
looked angry all the time.
Yeah,
Okay.
Procerus. So I like to do 2 or 3 spots. So more cheek. Yeah, there we go. More like this.
And
so,
what are you aiming for there? Sort of the
so I'm looking
apex
at,
of
I'm
the-
looking, yeah, exactly. So we're looking at the course of those lines, and we're going to
Okay.
kind of put a couple of doses right in the middle of them.
Oh, in the middle of the line.
Anyway, if you go about 1 centimeter below the course of the lateral, which is the outside edge of the brow,
Yeah.
it looks nice because you'll get a little bit of a brow lift. So that's what they're talking about when they
Oh.
say you can get like a little Botox brow lift.
Okay, cool.
If you do it too much though, then you get the
Look like
Spock
Spock.
eye.
Fascinating is a word I use for the unexpected.
So-
Okay.
We don't want to look like
Live long and prosper.
And another cheeky smile.
Okay, what Nicole doesn't know is that I'm going to be doing the injections for the first time in my life as an experiment.
Oh,
here.
that's so great.
No.
So cold and wet, Nicole. It's the alcohol swab just to clean the skin. So raise your eyebrows. So over activate that muscle. I'm watching the little increments carefully.
How much per injection there?
1, 2, 3. We're going to do 3 per site.
Okay.
Now we'll swap for the next syringe. Thank you, doctor.
Oh, my pleasure.
Okay, and we're going to do, I've got that, Nicole. Thank you. To do this guy, we're going to do 5. Last one.
Looks like you're going in just like a few millimeters.
Just under the skin, exactly. You want to get it into the muscle. So reach up with your left hand again, Nicole, and just hold some pressure there. Okay, now we're going to use our last 12 units for the crow's feet. So we'll do 3, 3, 3, and 3. I'm just going to rest my arm on you here, my hand rather.
So you want to zoom right in on that.
3.
See?
And last one there. 1, 2, 3. Good job. How did that feel? Good. A couple of notes too. You don't want to rub the product in. I'm just trying to dab it. So there's about a 3 centimeter radius that the product will act over.
Okay.
So you don't want to rub it because then you distribute the product too far.
Okay.
And that's what increases the risk of getting things like brow ptosis.
Okay, so you can see there's a lot of knowledge required to do this. Not just anybody can do this. There's a lot of science behind it, a lot of anatomy behind it, and you want someone who's experienced, who's done a lot of them before, and has really studied this well. Keep that in mind if you're considering doing this. Would that be a fair thing to say?
Absolutely.
Yeah. Wow.
I feel great when I get it done.
Really? Yeah.
We say we look 5 years younger, maybe not 10 years, 5 years younger.
If it were 10.
When it
She's
kicks
really 87. You would never ever guess that, and that's how she gets to continue working for so long.
That's right.
Yeah. Thank you so much for letting me share in this and letting us video this,
Thank
guys.
you for having me.
Amazing.
Thanks.
Again.
And we'll check in again in a couple of weeks and
Yeah.
see what it looks like.
Yeah.
Okay, wow, that was super interesting. To me, the surprise bars looked very comfortable.
Yeah.
It was relatively quick. So what does the normal post-op look like? So when do you normally see these patients?
So I always offer my patients a 2-week follow-up appointment for touch-ups.
Yep.
I'd say only about a quarter of people actually come for the touch-up, but we always call and offer that to them in case they notice some asymmetries. And that's sort of what I was alluding to when I was saying some people need a little more on one side, or if they're trying and if they've never had Botox before and we've started at a low to medium dose, it gives them a chance to go up a little bit. You have to ease people into it. You don't want to slam them with complete paralysis.
And I guess too, if you're doing a touch-up, you want to do it closer to the original injection. Otherwise,
Yeah.
the touch-up will persist beyond,
exactly.
and then you end up with another asymmetry, just the opposite one.
Yeah.
Now, just FYI, we were going to do my face too, but she said she
I
didn't.
thought you did it.
She said she didn't have enough Botox.
Not enough vials.
No, we didn't
More
have
vials.
And
We
she
got
was worried.
vials out today.
She was worried I may end up in a medically induced coma if we used the amount of Botox required.
Yeah.
So
We,
took a pass.
we earned these
Yeah,
by being old.
that's right.
Work stress.
Work stress. Okay, so 2 weeks, 8 weeks. So would everyone get the 8-week visit, or would some people would say, I'm not even going to come in. It looks great. I'm happy.
A lot of people don't come in
Really?
for
At all?
that
Interesting.
2-week visit. And then for their follow-up, most people will come back for more, anywhere between 3 and 6 months. So in some people, the effect lasts a bit longer than others. So they just come back when they're ready.
Just don't wash your face.
We will definitely have someone ask, is there a minimum amount of time that you have to have before you get a full dose? Or it's really kind of buyer beware,
No,
and if
it's
you
just-
like it at 2 months, then you get it 2 months.
Yeah, I'd say you wait at least 2 weeks for sure, because that's when they see the peak effect occurs. Most people will notice a change within sometimes 2 days.
Oh, wow.
But it really does take that 2 full weeks, and I've seen that before on my own face. So you do
Okay.
need to wait that full 2 weeks, and then you can do touch-ups, but
But if you got plans this weekend, there might be time.
Not time. No, you
Class
need to plan, you
reunion.
need to plan ahead.
Class reunion, okay.
Yeah, holiday parties are coming up.
That's right.
All right.
Okay, so let's take a look at the video where we looked at the follow-up at the 8-week mark and got to see the results, the amazing results of this intervention. So here we go, let's look.
8 weeks later.
Okay, here we are, 8 weeks after that procedure. Thank you so much for letting me be part of that procedure and watching it. Why don't you take us through now what the 8-week sort of follow-up is?
Absolutely. So why don't we have a look at Nicole and Alex and see how their rhytids are doing. So Nicole, I mean, you always look great, but look at that smooth forehead at
Right?
rest. And
So smooth.
raise your eyebrows. What a difference. Very subtle, but she can still move her eyebrows because you don't want to overdo the Botox. And if you
Right.
have no facial movement, it looks funny.
Yeah.
So that looks good. And give us a frown. So she still has a few lines, but they're quite subtle. So different people have different preferences about how paralyzed they want to be. I like a high level of paralysis for myself.
Okay.
I
Other
like to
people-
have
Fair enough.
facial expression.
Yeah, appropriate.
So that's why when you're starting with Botox, you start with a lower dose. You can always do more. You can't undo it. I mean, you have to wait for it to go, the effect to go away. But that's
Okay.
you know you were someone good if they ask you how many units have you had before, did you like it?
Okay.
So if someone tries to give you a huge number of units at once, then you know.
And so if you go low, you could touch up later if you wanted. So what would a
Exactly.
touch-up sort of procedure look like then?
Very similar to what we did before, but with
Okay.
smaller doses. And if there's asymmetry, like if when they raise their eyebrows, one goes higher than the other, or there's more creases on one side or the other, you might put a couple extra units on that one side.
Okay, so
And
that
then-
makes sense. So that's why that go slow approach works, where you can later come back and touch up if you need to.
Exactly. When you follow the same person over time, you get to know their little asymmetries. So some people you always need to put a little more on the right side as compared to the left, etc. And squint for us. So her crows look awesome. So,
Wow, this
So-
is incredible. And this is why it's so important. If you're going to have something like this done, go to someone who does a lot of these, who has a lot of experience. Of course, you're a plastic surgeon, so you know the muscles of the face so well, and that's why you've had such an incredible result.
That looks good.
Okay, wow, that is dramatic effect. You said it starts at 2 weeks, but at 8 weeks we could see the benefit. So let's talk about who does it. So it could be any different type of clinic, but it's typically under the supervision of a doctor, often by a nurse or an RPN or a PA, someone that has
Yes.
specific credentials and has had
Yes.
specific training.
Yes.
So like anything in life, often you're going to get what you pay for.
Yep.
So someone might sell you cheaper dollar per unit kind
Yes,
of thing, but
yeah.
with potentially less skill. And then they may sell you more units that you need.
Yeah,
So you
see
have
that
to
all the time.
beware, look to friend and colleague recommendations, find someone that has good reviews for what they're worth online, because I think those can be a little bit tricky. But as a plastic surgeon, during your training, you still had years of experience rather than just a one-day weekend course. So
Yeah.
give that some thought as far
Yeah.
as your
Yeah,
potential
if you
purchase.
take anything home, please go to a reputable place,
Yes.
preferably a surgeon or a doctor who's doing this, who's had extensive training and extensive experience doing this.
And I think makes it a significant part of their job. You don't want to come to us who replace people's hips and knees, and then now we do a little Botox on the
On the
side.
side.
Actually, next week I'm going to be injecting Brad's face after having zero training in it. So we're just to show you the dangers.
Yeah.
You're okay with that?
Just
right?
on one side.
Yeah. Yeah.
Okay.
Your good side.
Sure. I think that just about covers it.
Yeah, thanks a lot. It's amazing
Thank
that
you.
we got this from a bacteria, right? The Clostridium
wild.
genus of bacteria created toxin to kill people that did kill, and we've sort of harnessed it to do something beautiful with it.
Yeah, thanks to you. Thanks to Dr. Gitty and Dr. Callan, who kindly allowed us to
Lent
film
their
them.
faces.
Yeah, lent us their faces. So if you have any questions, have any comments, please leave them. It really helps other viewers make their decisions and learn about this process. And if you like this video, please like it, subscribe to our channel.
And remember, you can go to Dr. Willoughby's website and her YouTube channel to get more information about this
And other stuff too.
And
other stuff too. And you are in charge of your own health.
We'll see you next time.
Thank you so much.
Thank you for having me.